Welcome to the Dr. Mudgil podcast. This is episode 168. We are now in February. This year's already flying by. The older I get, the faster time goes by. Another week has passed. It's been a cold one here in New York. It's cold and like rainy / wintry mixy here in New York. I think we got some more snow headed our way towards the end of this week and early next week. To my kids' dismay, they thought school might be canceled today, but as usual, I think the weatherman got things, or weather people got things wrong. Gosh, that's a great job, huh? Like whether you're right or wrong, you still get your paycheck. But I think they missed the boat, and the weather wasn't quite as bad, or there wasn't quite as much snow as was anticipated. Although I know some school districts north of us were closed just because it was tough for the school buses to get out early in the morning. But anyways, let's get to the action. So, as you know, I'm no fan of private health insurance companies, and Optum, which is owned by United Healthcare. United Healthcare and Optum are probably the most vile of all institutions that exist. They really don't care about really anybody other than their shareholders, who they want to increase the price of their stock for. And all of the executives are very, very well compensated, and of course all of that profit is generated off the backs of patients and the docs who care for them. So I'm going to share a very sad story with you guys. So in the mornings in the Mudgil household, we have 3 kids, and my wife and I get up very early, and my wife prepares lunches for the kids, and I prepare breakfast for my little guy, and I drive him. He's in middle school, and middle school starts at 7:26 here in the town that we live in the school district that my kids go to. So I'm on the early shift. I drop him off, and then I'll come back or head to work or whatever I may be doing for that day. But usually in the morning, while my wife and I are getting the stuff ready for the kids, we have like one of the morning news shows on. Usually it's Good Morning America. And there was a story that came up, I think it was on Tuesday actually, that I saw this story about a young man who has asthma, and he was paying like $60 a month, something like that, for his asthma medications, but that price jumped up and to like $500 and something. And this was a young guy probably working his tail off and didn't have tons of disposable income. And when the price went up that much, he's like, forget it, I can't afford that. And unfortunately had a bad asthma attack and passed away. And when I saw this story, I was just like, obviously it's a terrible, terrible story. So I was sad for the family, but I was enraged. It renewed my rage for United Healthcare and Optum. But I want to actually share this article that I actually looked up. It wasn't really covered super widely on news, but I found this article, and I'm going to share it with you guys. And this article came out on February 3rd, which is just a couple of days ago. And it goes, Wisconsin man dies after inhaler cost jumps $500, according to family's lawsuit. A young Wisconsin man died from an asthma attack after the price of his inhaler skyrocketed nearly $500, according to a lawsuit filed by his family. Cole Schmidneck, 22, suffered from asthma, a chronic disease, and he treated with an Advair discus inhaler that allegedly cost him no more than $66. That cost changed last year when Optum Rx, a subsidiary of United Health Group, you know how I feel about them, stopped coverage for the inhaler Schmidneck used for a decade, the lawsuit alleges. On January 10th, 2024, Schmidneck went to his local Optum Rx Walgreens pharmacy in Appleton, Wisconsin, expecting to fill his usual prescription when he was advised by Walgreens that his medication was no longer covered by his insurance and would cost him $539.19 out of pocket, according to the lawsuit. He was given no notice, and the lawsuit said Walgreens did not offer him a generic alternative, and further told Cole that there was no cheaper alternatives or generic medications available. Unable to afford the inhaler, the lawsuit alleges he left the store without it. Over the next 5 days, Cole repeatedly struggled to breathe, relying solely on his old rescue emergency inhaler to limit his symptoms because he did not have a preventive inhaler designed for daily use, his family claims in the lawsuit. On January 15, 2024, Schmidneck was driven to an emergency room by his roommate for a severe asthma attack, but became unresponsive and pulseless in the car before reaching the ER, according to the lawsuit. After receiving cardiopulmonary resuscitation in the ER, Schmidneck spent days in an intensive care unit and never woke up. He was pronounced dead on January 21st after life-supporting care was stopped, the lawsuit states. His parents are now suing Walgreens, its parent company, Boots Alliance, and Optum Rx, the pharmacy benefits manager, for negligence. Defendant Optum Rx had a duty to not artificially inflate prescription drug prices for medications such as Advair Diskus for insured patients, including Cole Schmidneck, making them so unaffordable that patients could not obtain the medications their physicians prescribed, the lawsuit said. In a statement to ABC News, Optum Rx said Schmidneck filled a generic albuterol prescription, an inhaler used to stop asthma attacks, on January 10th, 2024, with a $5 copay, adding that the same drug was previously filled in October 2023 by him. The prescription service said that it also has available clinically appropriate options and formulary information when medication is not covered by a provider. In the lawsuit, Schmidneck's family claims Walgreens defendants failed to exercise reasonable care in that they knew, or should have known, of the unreasonable risk of harm to asthmatic patients, including Cole Schmidneck, that would result from their failing to provide him with Advair Diskus or a medically equivalent alternative medication at an affordable price at the point of service. Walgreens declined to comment on the litigation when ABC News reached out for a comment. Just a few months after Schmidneck's death, the makers of Advair, GlaxoSmithKline, announced in March 2024 that starting January 2025, the most people will pay out of pocket for their inhaler is $35 a month. GSK joined other manufacturers of inhalers in capping the out-of-pocket cost for inhalers, something Senator Bernie Sanders, a Vermont independent who chairs the Health Committee, commented on at the time. The three largest manufacturers of inhalers in the world have all committed to cap the cost of inhalers in the United States at no more than $35 at the pharmacy counter, he said. Dr. Jade Coburn, MD, MPH, who is board certified in pediatrics and general preventive medicine, recommended individuals who suddenly see an increase in medication costs or can no longer afford it speak to their provider about alternatives, check for current discounts to lower out-of-pocket costs by using an app like GoodRx, or reach out to the manufacturer for assistance or possible rebates. If you are struggling to breathe, it's imperative that you seek medical help immediately through your doctor by going to the emergency room or by calling 911, Coburn said. Well, that's the article, and it's really a tragic situation. So, Cole didn't have his daily inhaler. So when you have asthma, you basically use a daily medication that has a steroid in it and sometimes like a long-acting medication that keeps your airways open. And if you're having an acute attack, you use albuterol, which is what he got, which is your rescue inhaler. But you can't really use that all the time. You can use it like a few times out of the day, 4 to 6 hours apart, just to open up your airways. My daughter actually has terrible asthma, and when she gets sick, she has a very, very hard time breathing. And sometimes we need to do other things, like use a nebulizer, or sometimes use some oral medications just to help open up her airways and decrease the symptoms of her asthma. But poor Cole didn't have the medication that he needed to prevent him from having a severe asthma attack. I mean, I don't know the specific circumstances, but given the time of year, it's possible that he had like an upper respiratory tract infection that was further inflaming his airways, exacerbating his asthma. And then he was really in a terrible situation because Optum Rx, the absolute worst company in the world, because they're owned by United, decided that they're going to jack up the cost of his asthma medication, basically to maximize their profit. They do not give one iota about you as a patient. All they see are dollar signs in your pocket, and they were looking for any possible way to exploit you to maximize their profits. As I've said before, all of us pay our money into the pot, and the way insurance companies generate revenue is by either denying patients benefits or medications they need, like in Cole's case, or by having doctors see their patients. We get paid after a patient is seen. So they'll basically try to screw up paying us after we've already seen and cured the patient for some like technicality, like an I's not dotted or T's not crossed on the claim submission form. Because that way, they get us to see patients for free. So they're not paying for what patients need. They're not paying doctors after they've already seen the patient. It is an absolute racket. And this is what happens when decisions are made by vile companies like Optum Rx when it comes to patient care. Cole's doctor prescribed him this medication. He's had the medication, sounds like, for a decade without any issue. And then, it's the same medication. But for some reason, Optum Rx, which is a pharmacy benefit manager, they basically negotiate deals with drug makers, and they say, okay, cool, we're going to buy this medication for you from this much, but we're only going to buy this from you so that you'll get a lot of business from us, and then we're going to sell it to our patients for X amount. There are a middleman. They're just trying to make as much money as possible. So they're going to try to buy the Advair for the cheapest amount possible because they're going to use their negotiating power. We have this many millions of patients who have asthma, and almost all of them are on Advair Discus. So we're going to buy it for you. So say it costs like $300. We're going to buy it for you for $200, and then we're going to sell it to the patient for like $530, and then we're going to make a ton of profit. We're going to get so rich selling this medication, which is exactly what they do. They enrich themselves off of the backs of poor patients like Cole and off of doctors like myself and my colleagues. It's a tragic, tragic system. All of us need to be vocal and speak up about these sorts of atrocities. We are getting absolutely screwed by companies like United Healthcare, Aetna, Cigna, Blue Cross Blue Shield. They're all basically one and the same. United is the leader of the pack, the leader of vile practices, and everyone kind of follows their playbook because they're the best at screwing us over. And it's up to us to be vocal and say, hey, you know what? Enough is enough. We see what you guys are doing, and it's time for change. So with that, I hope you all have a wonderful, restful weekend. Remember, we must be vocal. Doctors and patients, we're on the same side of the fence. Insurance companies, pharmacy benefit managers, sprawling hospital systems, private equity companies, they're all the enemy. And they're doing everything they can to profit off of us. So we need to be as vocal as we possibly can. Let's get it.